Hi, everyone. My name is Lexy. I'm the Intentional Injury Prevention Coordinator here at the Wyoming Department of Health. I wanted to thank you guys for attending this webinar. Obviously, this is a really important topic, so it's really awesome to see the turnout today, and thank you to FRC for having us. So I will just get started. So in 2022, which is the last year that we have finalized data on suicide in the US, suicide was the 11th leading cause of death in the United States. Almost 50,000 Americans died by suicide, which works out to one about every 11 minutes, and there were an estimated 1.7 million suicide attempts. So the burden of this issue is really it's really huge all the way across our country. Uh, but in Wyoming specifically, thanks. So this is my very first time presenting with the new 2022 data where Wyoming has moved to the third highest suicide rate nationwide. This was just recently finalized by the CDC. We had been first for a couple of years prior to this. So it's good to see our rate declining, and hopefully we will continue on that route. But yes, Wyoming has the third highest suicide rate among all the US states. This graphic here shows the other states with similar rates to us. You'll notice a lot of states that that are nearby in the Mountain West and have a similar kind of cultural, occupational landscape as we do, all have kind of similarly high burdens of suicide in their states as well. Next slide. And then this is a state-specific breakdown of the burden of suicide deaths here. On the right, you'll see our suicide rate in the red compared with the overall US rate in the gray. So while they've both been overall trending up for quite some time, our rate is consistently higher than the overall US rate. And then the county map you see is the rate with all 23 counties in the state. We present this over 5 years. So the rates you're seeing are 2018 to 2022, and this is due to the relatively small counties that we have and small number of deaths. So we present these by 5 years, and all of this data is public on our website. I will show a link later that you can look at our website and our data dashboard if you're interested in seeing more here in the next slide, if you will. And then suicide deaths by method in Wyoming. So almost 80% of our deaths by suicide are by firearm. Most suicide deaths in the US are by firearm, but in Wyoming, our rate is a lot higher for a lot of reasons. But suffocation and poisoning are 2 and 3, but the vast majority of the deaths here occur by firearm. Next slide. Thanks. And then a quick comment on veteran status as well. Almost 10% of our state's population are veterans, which is one of the highest proportions nationwide. And veterans have a higher rate of death by suicide than non-veterans. So this is some data from the VA about comparing veteran and non-veteran adults. And as you can see, the rate of suicide by veterans is increasing, and that's why it's great to have a partnership with the VA and with Lauren and work closely with them. And just a little bit of introduction about what we do here at the Department of Health and our unit, and kind of some local resources. Each county in the state of Wyoming receives the Community Prevention Grant, which is run by our unit. And then each county has a community prevention specialist, a CPS, and they have a lot of focus areas, not just suicide. They also work on tobacco, opioids, adult alcohol overconsumption, underage drinking, and youth marijuana. So they're very busy. They're very busy people, and they're all really great. And then on our end at the state level, we have the Wyoming Injury and Violence Prevention Program, and we work on intentional injury, which includes suicide, self-harm, and sexual assault, as well as unintentional injury, which includes falls, car accidents, poisoning, etc. And then this link right here will bring you to our website. And if you go there and you click on suicide prevention, you can see the data dashboard that I had previously mentioned. on the last slide. And then this is the contact information of your CPS in your county. So like I said, we have at least one in each county, and they're available to help with suicide prevention trainings, talk to you about the resources we have. So please feel free to contact them. They're great local resources, and they have a lot better idea than I do about what's going on specifically in your local area versus statewide. And so they can often be a better resource than we can here to help you in your local area. And then I wanted to talk a little bit about the 988 suicide and crisis lifelines. Lauren mentioned them a little bit. So first, just a little bit about the warning signs of suicide. Obviously, it can be really difficult to tell, that somebody is at risk, but here we have some information and some behaviors listed that someone may be thinking about suicide. This includes talking about wanting to die, being a burden to others, having great guilt or shame, speaking about feeling empty, hopeless, extremely sad, being in unbearable pain, as well as some behaviors. These include making a plan or researching ways to die, taking extremely dangerous risks that are uncharacteristic for that person, kind of a marked or noticeable change, displaying extreme mood swings, eating or sleeping less, using drugs or alcohol more often than is usual for that person, withdrawing from friends or family, saying goodbye, giving away important items, all of that, basically kind of major changes that are far out of the realm of what that person would usually be can be signs that person is at risk. And that's why we have the 988 Suicide and Crisis Lifeline. So just another quick point that talking about suicide or asking someone if they feel suicidal does not encourage suicide attempts or increase the likelihood of that person dying by suicide. It's actually the opposite. Asking these questions can be likely to save a life. Talking about suicide can be really difficult. It can be really unpleasant, but it is essential and it does help. And staying silent is not the answer. But I know that it can be a concern for some people that kind of asking the question will put that in someone's head or something like that, and that's not the case. And so just a little bit about the 988 Suicide and Crisis Lifeline. We've had one nationally for quite some time. It was this 1-800 number, 1-800-273-TALK, which, isn't quite so easy to remember, doesn't really roll off the tongue. And so the US has moved to starting the 988 Suicide and Crisis Lifeline to streamline those calls and make it easier for people to remember what it is and to have it accessible to them. Next slide. And so the 988 Suicide and Crisis Lifeline offers 24/7 call, text, and chat access, chat online, to trained crisis counselors. Calls to 988 from a Wyoming area code are answered in-state by crisis counselors from one of two call centers. One is located in Grable and one is located in Casper. Text and online chats currently are routed to a national call center, although we're working really hard here at the Department of Health to open our own text line as well. But right now, all the calls are answered locally. And what's really important to remember is that all the calls to 988 are free and confidential. You won't ever be charged, and you don't have to provide any information whatsoever about, they're entirely 100% confidential. And then the trained crisis counselors are here to help if you're experiencing any of the following. A lot of people think that it's just, people at imminent risk of suicide or something like that. But the crisis counselors are trained to respond to a wide variety of crises, not just suicidal, but also any kind of mental health or emotional crisis, as well as some substance use crises as well. And you can also dial 988 if you're worried about a friend or family member or loved one who may need support. So you could be with them. You could also not be, even if you're not with them and you're still worried, this can be a great resource for you to call and discuss kind of your concerns and see what resources are available to you. Like I said, calls here are routed to an in-state call center, so they are prepared with local resources for you that could really be of help in an emergency. And a lot of people wonder what happens when you call 988. You'll hear a greeting message. Your call will be routed to a local Lifeline Network Crisis Center. Um, if the local crisis center is unable to take the call, you don't just sit there waiting. You'll be automatically routed to a national backup crisis center. We have some really, really great, the Casper and Grable lifelines are really amazing, and this actually very rarely happens here. I don't have the data right in front of me, but I am pretty sure they answer close to almost 100% of the calls that they receive. And then a trained crisis counselor answers the phone, they listen to you, kind of the call goes from there. The main question, does 988 send responders to my location? Almost certainly no. Most contacts, around 99% with the Lifeline, are resolved by the Lifeline itself over chat or phone in a manner that does not require or kind of create additional immediate intervention. Their policy and their training works with staff to engage the person to provide support and assistance in the least restrictive setting possible. No personal data is required to receive these services, so you don't give your location, your address, your name, any of that when you do call in. And that's really important. So it's not like, they're just waiting to send somebody out. This is really a crisis lifeline that is available confidentially to everyone around the state and the country. And that's what I have on my side. I'm happy to take any questions, particularly about the data. If anybody has any questions, wants anything expanded upon, I'm happy to help. And then you can also contact me at any time if you're looking for ways to get involved, more resources, just have questions about our prevention efforts here at the state level.
Thanks, Lexi. So we'll hopefully have time for questions at the end. So if you have a question right now, you can put it in the chat, and Ashley's going to help monitor those. And then we will kind of keep moving. Everyone can hear me? Thumb up? Good? All right, cool. So we're going to talk a little bit more about firearms and suicide, secure firearm storage, and out-of-home storage options. I always like to start this first by saying I am employed by the VA, but I work 100% of my time in the community. And I work with a lot of you who are on this call to help in the community to bolster suicide prevention programs, not just for veterans, but for our communities at large. I like to also remind all of us as we talk about firearms, there's an estimated about 400 million privately owned firearms in the US, with around 40,000 related firearm incidents a year. I say this because there's a lot of firearms, and relative to that, 40,000 related firearm incidents a year is not a tremendous amount. And I say this to say most firearm owners are very responsible, and they practice the safe practices of owning a firearm. And so by no means is today's presentation to say that that doesn't happen, because in fact, we know that it does. What we're going to gear this towards a little bit, though, is seeing how we can take those safe practices and apply those to suicide prevention. So just as Lexi showed, Wyoming's veteran suicide rate, so veteran, is 80% per every 100,000. It is the highest in the US. So although Wyoming's overall rate for its general population has decreased, our veterans have not. They have remained the top of that list in Wyoming since about 2010. And then but this rate is just significantly higher than anywhere else in the US. This is similar to some of our bordering states, Montana, Colorado. Geographically, we know that some of this might be due to being very rural or other instances. There's also the possibility that high rates of gun ownership could contribute to this as well, because most firearm related incidents, as you see here in Wyoming, were suicides between 2010 and this goes to 2019. The trend was the same for 2020 to 2022. So most of those firearm related deaths are suicides. So for veterans and suicide deaths by firearm, it is very large. Firearms are typically owned by veterans, and they usually own at least 3 by self-report, if not more in most cases. And we're also seeing a significant increase in trend among women veterans. In the past, many people thought that women were less likely to use a firearm. Well, in fact, we know that veteran women are 281% more likely than non-veteran women to utilize a firearm for suicide death. And so this is just something to address stigma and relevance, that this is not necessarily just a gender issue or a veteran issue, but that this firearm ownership does play a role into some of the suicide deaths we're seeing, not just here in Wyoming, but nationwide. So when I say secure storage of a firearm, what do I mean? Well, for the most part, I mean one of these methods. The firearm is unloaded and locked. So this could be a biometric safe, a small safe, a large safe. It could be a trigger lock or a cable lock. There may be even some other more non-traditional ways of securing your firearm. Gun rooms with vault doors, or even a room with just a keyless pad entry, like this one you see here on this slide. If you own more than a couple of firearms, it might be a better solution to keeping them all in one place, knowing where they all are, knowing how they're being kept. And then you might even have some kept in a safe inside that room, right? Or in cable locks or trigger locks inside that safe. You may have a hidden drawer safe here. Those can also be locked. I've also seen some people utilize keypads or biometrics for these as well, so that they maintain access and accessibility to that firearm while maintaining the unloaded and locked status of that firearm when not in use. And same applies for our vehicles. There are ways in which we can do this while traveling and transporting with that firearm. We can also look at this as a harm reduction model. If I have 10 firearms, I may need to just keep 1 loaded and ready, whether it be for my job or I'm ranching or something. That might be all I need. So instead of having all 10, I might have the others stored and unloaded someplace else. And you're all probably thinking, well, why are we talking about this? Well, the big reason is that when we're in a crisis event, the time to decision is pretty short, usually within an hour. So time from decision to action is so short, in fact, that if we can intervene with someone who's having a mental health crisis or is contemplating suicide, if we can limit their access to that firearm, we can reduce up to 90% fatality of that death, essentially. So if I can limit that access, I can decrease death. And we're not talking about limiting access from that firearm all the time, just in the time that it needs to be to help shorten that crisis and maybe find other methods for them to reach out, whether it be 988, a support system, accessing their safety plan if they have chronic suicidality, whatever that might be. Reducing the time that they have access to that firearm can really help save a life. This is so important in building space and time. Even if it was only 30 minutes, we can then decrease that impulsivity and that harm that they're going to potentially have for themselves, and also take that opportunity to talk about what's going on and get them assistance. There are some veterans and people I've worked with who, part of their safety plan is they already have it set up that when they're beginning to have these thoughts, they have a plan for their firearm. They have a plan to remove that or to store it securely in their home so that they do not have access to it if that crisis were to arise for them. And we're going to talk about that a little bit today. One of those is going to be in home, or what you might suggest someone do with a firearm. So on the last couple of slides, we saw all of those secure firearm storage options, right? We'll go back 1 second. All of these can be utilized in home, right? So we can have these and we can practice a Swiss cheese method too. If I'm using a cable or trigger lock, I might provide that key to a friend instead of keep hanging on to that key myself. I might change the code to that safe or have someone else change the code so that I have that limited access. Some of these other safes that are small, I might transport those to someone to hang on to, not give them the code necessarily, but transfer that firearm to them temporarily. What are some other things that we can potentially do? Like I said, store the family or friend. In Wyoming, you don't need any special paperwork to do that. As long as that person can legally obtain a firearm and they are also not at risk themselves, a family or friend can store that for you. You could also store someplace else, a gun range that you go to, or one of your gun clubs. Or a storage facility. Some of them, as we'll talk about later, out of home options that are, in your area could be a viable option. You could also look at going and pawning it. You can always sometimes change that, if you decide I don't want to pawn it anymore, sell or pawn. One colleague of mine who speaks really highly of this, when they are having suicidal thoughts, it used to stimulate around just one firearm that they owned. And so they had many other firearms, but instead of getting rid of all of their firearms, they sold the firearm that they were fixated on, and they kept the others, and that has limited their risk. And they have a plan for their other firearms in a way that they've decided and they've chosen to have. You can store with police. Not everybody's first choice, and some police stations don't always have room, but that can be an option. And then again, the safe storage at home that limits access. Some of these can also be removing the ammunition from the home, right? Firearm with no ammunition, it's not going to be operable, right? So if we can take that ammunition, store it at a friend's house, store it someplace else, maybe put that in a different safe with a different code that somebody else has the information to, or just making that firearm inoperable, removing the firing pin and letting somebody else hold that firing pin, or potentially, as we talk later about outside of the home storage, having an FFL do that if that's something they can do. Again, locking it up, giving someone else the key, and then just storing that ammunition separately. This probably all sounds great. And you're like, oh yeah, these are wonderful ideas. These are great, but why don't we do those all the time? Well, as we know, as a firearm owner myself, most people have a lack of trust, or they're not sure of what to do. Having these conversations can be challenging or difficult for some people. They may not know where to start. And so let's open up that conversation a little bit. We want people to know that one of the goals I have is educating clinicians on being able to have these discussions about firearms, so that these ideas of being a disguised attempt to restrict firearm ownership is not true. And it's also not true that if you are receiving mental health care, or you are even ever, if you are voluntarily hospitalized for mental health care, that means you can never own a firearm, because that's not true. And that is something that gets kind of mixed in these two areas of firearm ownership and mental health care, and they can exist together. You can receive mental health care and still maintain your firearm ownership, in the same way you would want to mitigate unintentional harm or theft. We can also mitigate suicide through secure storage of firearms. Some of these barriers, though, also include kind of the cost to secure all firearms. We do provide free cable gun locks, but that's not always the best method. And it can be expensive to buy safes and things like that. So that is a barrier, and we want to help limit that. I do like the creative ideas of the keyless pad entry, or creating a room that's dedicated to that, and creating some type of locking system, some locking mechanism. And also just improving your overall storage at home. I touched on this a little bit, so that some of the ways in which we want to address these barriers for gun owners is addressing the stigma, like I said, and also creating stronger partnership with local firearm retailers. We're going to talk about that in the next section, but this is really important. To have an out-of-home storage option FFLs and local firearm retailers play a really strong role in being able to be that person in our community, especially if we don't want to rely on police, because that can be uncomfortable at times. But we also know that who we've talked to in our communities about secure storage of firearms, everyone we've talked to has wanted to prevent suicide. Every firearm owner I've spoken to wants to prevent suicide. They want to prevent any type of harm that is unintentional with a firearm. And so promoting secure firearm storage, not just for theft and unintentional harm, but also for suicide prevention, is really important. And I think it's something that we as a community can start having a conversation about more. So what is out-of-home storage? Well, out-of-home storage is just what it sounds. I take my firearm someplace else to be stored securely while I voluntarily and temporarily do not need access to it. This is very well received if voluntary and led by our firearm community. Here in Wyoming, we have 2 retailers who are participating in this, and we're looking to bring on more of the firearm community to see their thoughts and how they think about this in our state of Wyoming. The Armory Project in Louisiana has done a lot of research on this, and it has significantly informed the creation of the Wyoming map. We also want to help address some of the concerns that people might have about out-of-home storage, such as transfer process, return liability. If I take my firearm to someone, how do I receive that back, and when and how? And then just how familiar are people with the comfort of someone holding their firearm? I grew up in a very rural area on a farm, and there were 2 or 3 times that my mom and I drove over to a friend's house, and she came back out and put the shotgun in the trunk of the or the cab of the truck and said, "Hey, we're gonna take this for them for a little while. They just can't have it right now." And I remember that as far back as being 8 years old. And so my familiarity and my comfort of taking care of our neighbor to help them and holding their firearms during a time of crisis or other temporary situation might be something even as simple as you're moving and you're showing your home, and you just don't want anyone walking around your house when you're not there who may try to gain access to your firearms like any other valuable item. Maybe your grandkids are coming to visit, and you just want to take that extra layer and making sure that they don't gain access to that firearm. We know that for teens, there's a growing increase in suicide deaths with firearms throughout the nation. And so this could also be a way of when we notice our children who might be in crisis, how we can remove that firearm from that situation to create a safer environment for them and us. So what has Wyoming done? Well, we've partnered with the University of Wyoming, the Firearm Research Center, with the Wyoming Department of Health, the VA, and Walk the Talk America. We recognize the importance of supporting both firearm ownership and the ability to reduce suicide, and allowing our community to be a part of that conversation and how they'd like to do that. And so, as other states have done, we have created a map. You'll see on the left-hand side, the map that is on the FRC website includes also locations in Montana, Colorado, Nebraska, and South Dakota. And we do this because some people are transient and they come through, but they also may have different reasons why they maybe need to store in Colorado or Montana, and just kind of to show there are resources within the states surrounding us because this is a similar concern they have. And then you'll also see our Wyoming map. It's a little hard to see, but down here in Laramie and Cheyenne, behind the blue and the yellow dot, are 2 red dots. The red dots with a firearm represent the FFLs, or the firearm retailers that are willing to store your firearms. Always call ahead to make sure that there's a couple of things. You know their practice there at that FFL, because each FFL gets to decide and how they participate, and if they can at that time, depending on space and things like that. And then you'll also see the blue shields. These are police stations or sheriff's offices that have said that they will also participate. As many of you may know, in some of our more rural areas, those police stations may not have room. And so again, still really important to give these little blue guys a call. And then the yellow flags are the 2 VA hospitals where you can obtain free cable gun locks, whether you're a veteran or not. We also provide these to the county prevention specialists and FFLs so that if you need an extra one, you can pop in and get some. But if maybe you're a prevention specialist or you're working in suicide prevention or firearm secure storage, you can also reach out to us and we can provide you with free cable gun locks. We did have a really cool story out of, I think it was Clearwater, of a CPS who was able to deliver over 40 cable gun locks to someone to help them lock up and secure 40 of their firearms during a time when they felt like they needed to. And so that was a really great implementation of a lot of firearms, not a lot of space, but let's get some cable locks on them to kind of shorten again that time and space between that firearm. So what does this look like across the US? Well, there is a national program called Hold My Guns, and one of our FFLs here in Wyoming does participate with Hold My Guns. And Hold My Guns is a really cool organization in that they're a nonprofit that's dedicated to helping FFLs implement this practice if it's something they'd like to do. There's a number of benefits to FFLs in doing this, and we'll talk about that later. But they're there to help the FFL do that. So if you're an FFL and you're interested, they're a great resource to help with those processes and procedures, what it looks like. We already have an active Wyoming contract, meaning there's a, when you go in and they have the hold agreement, we have one of those that's already active. They have attorneys on staff to also help answer questions and things like that. So really can't say any bad things about Hold My Guns. I'm hoping that they're able to be a good resource for our state. Other states that have out-of-home storage: Louisiana, Colorado, Washington, Utah, Tennessee, Wisconsin, Maryland, South Dakota, Vermont, Virginia, New Hampshire, New York, and New Jersey. And what I'll say here is that all of these look different depending on that state and the needs of those communities. They all look the way they need to for that state. And that's our hope here in Wyoming, to make this an option for people and a comfortable one for them that fits their needs here. So what do gun owners say? Overall, many of them have good responses to this. And both of these quotes are from people that we've spoken to. One saying, I realize not everyone has a friend like that can, hold, supposed to say hold, and hold on to a firearm and not freak out. So the option for a gun shop as a way to step up to that is a great partnership. And it's been really helpful for this veteran. This other person thinks being a responsible firearm owner means that they store their firearm in a way that won't hurt me or others, and that includes when I'm having a mental health concern. Having the option to store my firearm at an FFL helps me keep that promise to myself and continue to be a good firearm owner. So it's a way for them to keep that promise to themselves. When they said, I'm going to own firearms and I'm going to make sure that I treat this firearm with respect and I uphold all of those promises, being able to store my firearm in a secure way, whether in my home or outside the home, helps me do that. You're probably thinking, what are the firearm retailers' concerns? Well, they all have different ones, but these are the ones that come up the most. Liability, what happens, or how do I return a firearm? Many FFLs choose to do an additional background check to return that firearm to someone, which is pretty customary. They're also worried about the paperwork burden. They can be worried about space. What kind of space do they have at their facility? Many local retailers are very small, and so having space can be an issue. If somebody comes to you and they're in a crisis, what do they do? Who do they call? How do they get that help? Um, what if they did something with that firearm before bringing it to me? And that something could be fill in the blank. Yeah, what happened with that firearm beforehand? It's a really good question. And then again, background checks. Who gets them, when, why, and how? How do you have that conversation if somebody brings you a firearm to hold on to? Um, are you comfortable talking about suicide? Are you comfortable talking about those things? Or is it a no questions asked? I'll hold it for you. These are two pictures from the two FFLs in our state who are currently participating, Frontier Arms. They've been doing a practice like this for about the last 10 or 15 years, I believe, without this map, without our help or assistance. This is something that they thought was something that they can offer to their patrons and the people that count on them in their community, and they've been doing it for veterans and the general public alike. And then Gold Spur Outfitters and Laramie, they've also been providing this service, and they utilize Hold My Guns to help with their paperwork, liability concerns, and things like that. And I know this is very small, and so I don't expect you to be able to read it, but this is Brian Dimhoff and Lloyd from Gold Spur, and they did write a letter in regards to their support for out-of-home secure storage. And some of the things that they know is just the enhanced safety it can provide, the protection against theft, creating a crisis buffer. This is something that Brian has talked a lot about, which is, having a firearm immediately accessible in such a time could be dangerous. So that remote storage acts as a safety net in those situations. And being able to identify, you know, solving being able to solve that problem, and saying, well, let's remove the firearm, and knowing that there's someone you can count on to do that for you. And maybe you don't want to call on your friends or family. They might ask more questions than they would. They believe that this helps build trust in the community. There's a strong message in the community. While they have the right to bear arms, they're equally committed to the safety and well-being of their community. And so they like the ability to be able to self-regulate and adapt in their industry, and avoid any further laws or infringements. So them offering this service is a way that they see it as being able to uphold their commitment to the Second Amendment while also supporting their community and helping creating a safer environment and decreasing any unintentional or suicide deaths. And then they also believe that it's a customer convenience. There can be enjoy the benefit of knowing that there's someone that can store their firearm for them, and maintain full rights and ownership and flexibility and access to that firearm. Brian also states that by being able to provide an out-of-home secure storage option, you're positioning yourself as a responsible FFL. So upholding industry's high standards of safety and responsibility helps differentiate your business. And then customers become increasingly supportive and, creating a bigger community of not just purchasing firearms, but prioritizing safety that you can solidify together, and solidify the reputation. They also believe in doing some educational initiatives. So addressing some of those, what do I do if somebody's in crisis? And so providing them and their some of their staff with information about 988, how to recognize if somebody might be feeling in crisis or suicidal. Just being able to be open to that information is really important, while also promoting proper firearm safety. They also think that the awareness that we can create about this option will help save lives. And these shared collaborations between public health, the community, and FFLs will help decrease suicide deaths in Wyoming. And as we discussed earlier, I don't think there's a single person I've ever met that hasn't been touched by suicide in some way in Wyoming because of our high rate. This is a personal thing for many people. Many people are affected by this. And if this is one thing we can do to help reduce those numbers while also helping someone feel comfortable with that decision, then it's a big win for our community to help and decrease not just the rate, but each life lost and each family impacted and each community that is impacted by that loss. Many of us wear multiple hats in that community. So when one person dies, um, many things are impacted and many people are affected. So how does this partnership, how does this map support FFLs? Well, we help refer for legal assistance. Right now, the biggest one is Hold My Guns. Like I said, you can reach out to them. If you are in a community where you would like your FFL to do this, reaching out to them, talking to them about it, seeing if it's an option. Like I said, Frontier Arms has been offering something like this to its patrons for about the last 15 years. And just few people kind of knew about it, but then now that people are starting to know a little bit more about it, they've developed a little bit more of a clear process, and people in their community who maybe didn't purchase from them but live there know that they can reach out to them when they need help or assistance, family members and gun owners. Um, we help inform shops on the process, but the shops get to do whatever works from them. So this map is really just the infrastructure. If you want to offer this or you want someone in your community to offer this, they can list it on this map so that if in the future this can become a resource for people to say, hey, let's look at a place where we can do this. Instead of maybe calling an FFL blind or reaching out to family and friends, if that's not an option, a map exists where you can find that location, give them a call and say, hey, we're coming in. Shops get to decide the process. They get to decide what this looks like for them. They can partner with Hold My Guns, or some utilize processes that are already in place, such as their consignment options or gunsmith and cleaning. So this could be, they drop it off for alterations, gunsmithing, or cleaning during what might be a crisis time or a time in which someone needs to hold their guns, and they just do the same process they would if somebody was dropping off their firearm to be cleaned. And then they store that firearm for them afterwards. The shops get to decide if they charge for this service or they don't charge for this service. Many times, if it's a crisis, they will do it pro bono or a very low cost. Other times, if it's a more permanent situation because they need, that secure storage for other reasons, maybe they're on a college campus or they have, someone staying with them that can't have access to that firearm, a family member or a friend who might be on parole or probation, something like that. That's all up to the firearm retailer and how they want to make that agreement and what they need to do. We also support them with training and suicide prevention, QPR, handouts, community referrals and services. Letting our FFLs know what resources are available in our community is so important. They are a member of our community. They are just as better suited than anyone else to help refer someone to mental health or to a healthcare provider or any other resource. Might be a food bank, a church group, any of those things. Maybe it's just getting in contact, getting connected with a group of fellow people. Maybe it's a sport shooting club. They can be an integral part of that, and we should include them in that. So we really like to keep them abreast of what's going on, include them in our efforts in suicide prevention, and also, feeling like we can refer people to them too if they're interested in what's going on in their community as it relates to firearms or even suicide prevention. Some FFLs also, I forgot to mention, for that process, if they don't want to hold the whole firearm, some might agree to hold ammo, or they might agree to hold the firing pin or other parts to that firearm that make it inoperable. So there's lots of options here to fit the need of who you're working with or for you yourself. It's really about where you're comfortable and how we can reduce, again, that harm that might come about if we're in a crisis situation or if someone else around us is in a crisis situation. So if you or someone you know is an FFL and would like to partner, they can kind of scan this code and add their services to the website. they can withhold their guns. They can reach out to myself or Lexy, and we can have more conversations about this, or Ashley, anyone you're comfortable with. You could even reach out to Gold Spur. They're open and interested in talking with anyone about how to implement this and how it's been working for them. And it's kind of as simple as that. Quick note on current legislation. Wyoming has no legislation regarding firearm hold agreements. There is legislation in regards to firearm sales, and there being no liability for firearm sales, but nothing specific to firearm hold agreements. Now, there are 2 states that both passed bipartisan legislation to create language that helps FFLs be immune from civil liability, except in, cases of unlawful conduct, of course. But Louisiana and Montana have done this, and it has helped FFLs feel more capable of taking this on, because many of times you'll know that this is their livelihood and they don't want to put that at risk. And as much as it might help the community, they also have to watch out for themselves. And so in these 2 states, and there's conversations about this legislation in other states as well, and how it might be helpful for the FFLs. Finally, what are some of the implications for out-of-home storage? I am so glad you asked. Well, we hope that overall there will be a decrease in suicide deaths, and also a decrease in unintentional harm from firearms. We think that this could also create a community collaboration and support to mitigate suicide. We oftentimes don't know exactly what we can do all the time, right? Like, what if we don't know someone or somebody's not currently in crisis? What can we do? And promoting secure storage of firearms could be a great way to do that and bring in the community together on something that firearm owners and prevention specialists agree on. It can also help with uninfringed firearm ownership. The more comfortable people are about talking about their mental health and what's going on, and mental health providers and physicians alike understand that someone who has a mental health condition or has been diagnosed with something, that doesn't immediately impact their ability to own a firearm or care for it responsibly. There are things that we can do to help them maintain that ownership and create a safe environment. It could result in potential legislation to provide immunity from civil liability for the hold agreements like we just discussed. And then potentially there may be funds to support FFLs in doing this. Like I said, space is a big issue, and then liability and making sure that they feel secure and safe with those agreements can sometimes take money. And so if we're able to support them with that, we can help support our community at that larger scale. That's my information. I can continue to share my screen and leave it here, or I can stop sharing. But Ashley, I believe if there are any questions, feel free to take my name, my contact information. You can call, text, email. Happy to talk with you. No issues.